Another tool is the Plan, Do, Study Act. In this clinical setting situation, the plan would be as follows. Developing and conducting a high-profile screening assessment tool for pregnant mothers would result in a decrease in the incidence of sepsis and sepsis-related fatalities in newborns. According to a sample that was taken from newborns weighing less than 1,500 grams at birth weight who would require sepsis treatment, there was a positive response in the health-related interventions when conducted in a timely manner. A bundle of measures including a strict aseptic technique for sepsis management did not result in a complete reduction when compared to a standard technique. Act. The new practice proposal would be aimed at decreasing the number of preventable cases of sepsis in newborns. This can be approached by conducting a high-profile screening on mothers that were scheduled to deliver healthy babies. This includes mothers who have maintained the normal number of doctor visits and follow-up care. The screening would include a risk factor checklist that would be implemented in order to assess for signs and symptoms that could indicate a possible risk for development of sepsis in the newborns. Although at times the factors that lead to sepsis are not completely visible, the diagnosis and aggressive treatment of a newborn with sepsis can highly impact the outcome of morbidity and mortality in the neonate. Included in the intervention would also be the presence of a high-skilled neonatal resuscitation team that can work directly with the multidisciplinary team to develop and individualize a plan of care for the expected newborn. In summary, although there is a high rate of prenatal care in the United States, there continues to be a constant rate of newborns developing sepsis during the first 28 days of life. Therefore, there must be additional actions in order to reduce the risk and increase sepsis-free newborn babies. Interventions such as screening for risks and addressing those risks in order to prevent the development of bacteria responsible for sepsis in newborns, as well as continuing to educate the mothers and their families, may serve as a method to address the situation. Assessing the implementation of these interventions can provide a deeper insight on the benefits it may have to improve the outcome. A positive outcome would improve the lives of the mothers, the families, and the newborns that can be prevented from developing sepsis, and therefore increase the quality of life.